So this video is going to deal with the causes of infertility in males and females. This infographic has got lots of information about infertility, but what we're going to deal with is the part down at the bottom. So you can see that fertility declines with age quite significantly. And you can also see the definition of what infertility actually is. If the couple are under, or particularly the female is under 35, they have not conceived after 1 year of trying, or if the female is over 35, they have not conceived after 6 months of trying. Okay. Right, so we're going to discuss all of these different causes of infertility. Right, so you can see that causes of infertility are split mainly quite equally between males and females. Sometimes it's the males, sometimes it's the females. In 10% of cases, it's both males and females. And then in another 10% of cases, it's what we call unexplained infertility, which means there is no physical reason why the couple can't conceive. They have just been unable to conceive. So, in men, the main causes of infertility are age. For all men are continuously fertile, their fertility does decline as they get older. There can be certain genetic conditions that mean that men are infertile. Certain diseases, for example, sexually transmitted diseases, mumps, which if contracted after puberty, can cause testicular inflammation and then result in sterility, and also testicular cancer. Also, lifestyle factors can have quite a big influence on fertility in men. Smoking, stress, poor diet, abuse of drugs and alcohol, and particular medications can all affect men's fertility. Okay, so we'll just discuss these in a little bit more detail. And for males, the main causes are to do with sperm production. Okay, so you can get sperm duct blockage, which means that the sperm cannot get through the vas deferens and out of the body. You could get a low sperm count. You can get poor sperm motility, which means the sperm are not able to swim properly. And you can also get abnormalities with the sperm. Okay, so like I said, sperm duct blockage. The sperm duct could be blocked with scar tissue, and that can often come about from having infections like chlamydia or gonorrhea. So one of the tests that will be done if a fertility problem is suspected is semen analysis. Okay, and the things that the researchers will look for is the volume of semen that's produced in an ejaculation, the total number of sperm produced in the semen, which is called the sperm count, and also the number of sperm in each milliliter of semen, which is the concentration. They'll also look at the motility of the sperm, i.e. how many of them are moving normally. They'll look to see if the sperm are the correct size and shape. Okay, and semen analysis can also detect if there is an infection in the reproductive system. Okay. So, poor sperm motility means that the sperm are not able to swim effectively and they would not be able to get to and fertilise the partner's egg. Okay. If there is a low number of sperm in the semen, then that would decrease the chance of fertilisation. And a low sperm count is classed as having less than 15 million sperm per milliliter. Sometimes sperm can be abnormally sized or shaped. Okay, so you can get sperm with abnormally large or small heads, you can get sperm with 2 heads, you can get sperm with 2 tails, and none of those sperm will be able to swim properly, so they won't be able to get to and fertilise an egg. Okay. So just to summarise, what you need to know are you need to be able to explain some of the causes of male infertility. Would it be sexually transmitted infections or lifestyle issues such as being overweight, smoking or drug taking, excessive alcohol intake, or being stressed. Right, moving on to infertility in women. Okay, there are again several factors that can cause infertility in women. Age, right? As a woman gets older, her chances of conceiving get smaller, particularly over the age of 35, and as she approaches the menopause. Again, there are genetic conditions that can make a woman infertile. As with men, sexually transmitted infections can cause infertility. For example, gonorrhea or chlamydia can cause inflammation and scarring of the oviducts. But there are other diseases like kidney disease or polycystic ovarian syndrome that can contribute to infertility. Eating disorders, being very either underweight or overweight, can disrupt the menstrual cycle because it affects estrogen production. And again, lifestyle factors, smoking, excessive drinking, use of particular medications or drugs can all interfere with fertility. Okay. So, main causes of female infertility. Endometriosis, which we'll come back to in a minute on the next slide. Ovulation disorders, abnormalities in the uterus and cervix, or damage to or blockage of the oviducts. So endometriosis is a very painful condition where endometrial tissue grows in the body somewhere other than the lining of the uterus. Okay, it can attach itself to the outside as there, or even the inside there of the fallopian tubes. It can sometimes attach to the ovaries, or it can sometimes attach to the bowel inside the cavity of the abdomen. Okay, and what happens is these bits of endometrium still respond to the hormones estrogen and progesterone like the endometrium in the uterus does, and it can cause severe pain for the sufferer. Ovulation disorders can result from things like polycystic ovarian syndrome, where you get lots of immature follicles that fail to produce an egg, or thyroid problems, or sometimes you get premature menopause, whereby the woman's ovaries stop producing eggs before she reaches the age of 40. And sometimes there are hormone imbalances that prevent ovulation. Okay, you don't need to know the details about polycystic ovarian syndrome. Sometimes abnormalities of the uterus or the cervix can be the cause of female infertility. So if there's a problem with the cervix, it might mean that the woman can't carry a baby to full term. There can be abnormalities in the shape of the uterus. Sometimes you get non-cancerous tumours. These are called fibroids. They can grow into the uterus. They can also block the fallopian tubes. They can also interfere with implantation of the embryo. Okay, and oviduct damage or blockage usually results from inflammation of the fallopian tube, usually but not always from sexually transmitted infections, but it can also be caused from endometriosis or adhesions, which are scar tissue within the uterus or the oviduct. So now you're going to go on to your activity, which is to create a poster summarising the causes of male and female infertility using no more than 20 words.